How many times have you said, this is going to be the beginning of the year. This year it's going to be different. I know I have. Yet, how do you make it happen? Our guests today are doctors from various fields of medicine, yet what they all have in common is straight talk. So get a glass of water and get something to take notes with, because as we begin our pathway to a healthier new year. I'd like to welcome Dr. Barry Rothman.
Thank you.
It's a pleasure to have you here on the show.
Thank you very much.
Well, tell us about your practice.
I am a member of a 5-person practice. We have 3 young ladies, and another gentleman and I are the 2 males in the practice. It's a obstetrics and gynecology practice that we do high-risk obstetrics. We do all sorts of gynecological surgery, and we do a very large private practice clinic that's over at Seminary Road and 395.
Wow, wow. So in terms of being a healthier person, you see many people coming in. What are some of your observations?
One of the biggest observations I have about practice is that approximately 40% of my patients that I see on a daily basis are either overweight or in the obese category, depending on weight and height. It's a significant problem. We talk about breast cancers, obviously, and we talk about diabetes and hypertension and cardiac disease. But being overweight and obese are some significant medical problems that we have to discuss with our patients on a daily basis.
Daily basis. So when you say that, let's say if I'm in that situation and you're speaking about me, what are some of the tips what are the things I need to be doing?
Well, I try to take the time to talk about diet. I think that's the most important thing. I think that what you're eating for a breakfast, go over specifics, what you eat for breakfast, what you eat for lunch, what you eat for dinner, what do you snack on, what time do you do your meals, along with exercise. You know, how much are you getting in per day? And you don't have to join a gym. I always tell my patients, you don't have to join a gym to exercise. Get out there and walk for 30 minutes. And you walk 4 out of 7 days. And you just do a vigorous walk, a little bit faster than a shopping mall pace, but a good brisk walk. That's all you do. You don't need equipment for that. You don't need to go to a gym for that. You can just do it out on the streets.
So I don't need to, let's say, get this big membership or anything like that. I just need to just walk.
It always helps. I mean, if you have the equipment there and you want to do some other exercising like weights or a treadmill or an elliptical, that would be fine for joining a gym. But I always tell my patients who don't have any time because they're so busy in work and family that just get outside for 30 minutes. You got 30 minutes to get outside and take a walk.
Wow, that's inspiring because and being outside makes you feel better.
Sure,
so
sure.
That's
On
good.
a day like today and it's beautiful and it may be brisk, just get out there and just do that walk.
Really good. What about when we live in this really fast-paced world and I don't necessarily have time to go home and cook and all, and are you going to tell me that I can't go to fast foods? I see that little smile on your face. I sometimes want to go to my local fast food place. Can I eat there and still
Sure, you
be
can
healthy?
eat there, but stick with the salads. You know, stay away from all that junk on the sandwiches. And, you know, we always go in there and, you know, French fries, this, and onion rings, that, etc. You know, eating a salad is sometimes a wonderful alternative to what they're serving. Fast food's not great, but even if you go out to lunch or dinner and you go to just a generalized restaurant, you have the opportunity to order salads, to order greens, to cut down on that carb intake. And that's probably one of the most significant things in ordering.
So you say carbs, so carbs are not really something that I should be like making most of my diet, huh?
I just think, generally speaking, in our population in this country, we just do too many carbs.
We do.
And there are some healthy carbs. Apples are good and oranges are good. But when you talk about pasta, and you're talking about potatoes, and you're talking about certain rices. You're talking about many breads. You know, some people, you know, they go to a football game, it's football season, so they're going to somebody's house for football. So what are you going to do? You're going to eat chips and dip, and have some wings, and have a few slices of pizza, and there's nothing nutritious there.
Okay. All right. So now you're inspiring me. Okay. So I can do that, but make sure I have some celery sticks out there.
Sometimes you just volunteer. I'll bring some food, and you bring the food that you can eat.
Oh,
and
I
you know,
love
everybody
that.
else is bringing salads and macaroni salad. Bring a healthy salad.
Okay.
Where you can actually, you know, you eat. There's nothing wrong with wings. It's what they're dipped in. So grill some rings yourself and bring them over, and then bring the sauces so everybody can enjoy what they want.
So it's being healthier, it's making those positive choices. So, you know, I also get very concerned because I have friends, and then, you know, we'll talk and they'll say they're going to go on these diets, and it's almost like a crash diet. And I don't know whether or not, is that really like wise to do something like that?
I personally am not in favor of those type of diets.
Okay.
And the reason being is that you can lose weight on most of these diets.
Okay.
They don't teach you how to keep the weight off. So it's called a roller coaster. They gain the weight, they lose the weight. They gain the weight, they lose the weight. And they get frustrated with it. In certain weight programs, we need to teach our patients that this is what you need to do all the time.
Wow.
And it's, you know, if you want to call it a carb addiction, you treat it as, I can't eat those foods.
I can't eat it.
And it's something that, it's a philosophy. And I have patients that come in all the time going, God, I'm on my heavier side now, and I was 30 pounds less and I gained it all back. And I'll ask them, why did you gain it back?
Wow.
I guess I didn't eat the foods I was supposed to be eating. So it's something, if you started January 1st,
Okay.
approach it as a lifestyle change, not a diet.
I love it. So it's a lifestyle, and that's, I think, that we all have to remember. Hopefully our viewers are thinking about it. It's not a diet, it's a lifestyle.
Correct.
So okay.
So to get the person to lose the weight is not difficult. Most people can lose weight when they're told the right foods to eat.
Okay.
So we have a model here that we've just taught you the right foods to eat.
Okay.
We also have to teach you, you have to stay on these foods. Now, in these diet programs that are the real fancy stuff and this and that, you lose the weight, but they don't teach anything. They don't teach you. This is a lifestyle change.
It's a life.
You know, when somebody says, am I going to eat ice cream again? And I go, yeah, you can have a scoop every once in a while, like once a month,
Yeah.
but not every single night.
Yeah. And boy, when you say every single night, and that's really the truth, because we used to do that in my house. We did. And then I saw us all gaining weight. I'm like, this is not a good thing.
Right.
So you're right about that.
And there's one more thing for your people that have kids. You know, you take them out to the McDonald's. You were
Yes.
talking fast foods and the Burger Kings and everything, and then they eat half their sandwich and they leave half their French fries.
Okay.
Don't eat the rest of the food.
Oh no. I'm the cleanup team.
Correct, and we as parents have that habit as a habit.
Okay.
We, you know, because we were taught that, oh, don't waste food. The people in Europe are starving, or the people in China are starving, or this and that.
Yes.
So we were taught when we grew up,
Okay.
you have to finish your food. You have to eat
Okay.
everything. So we feel guilty, subconsciously,
Yes.
that when we go out there, we're throwing away food. Oh my God. Sometimes you have to look those French fries and say goodbye to them.
Say goodbye to the French fries. That's a hard one, but I think that with January starting here, it's time to say goodbye to the French fries. But by saying goodbye is a healthier new year for me.
Correct.
And that's wonderful. Well, Dr. Rothman, I think you've given us some amazing tips about how we can stay a lot healthier. You're talking about us making a lifestyle, not a diet, it's a lifestyle.
That's correct.
And it's wonderful how you speak. Straight talk, that's what I love about you. Straight talk. Get outside 30 minutes, do a brisk walk, as well as making changes, but thinking about it, it's a lifestyle, not a diet.
Correct. And you have control over that lifestyle if you want to.
It's a pleasure having you.
Thank you very
again.
much.
Thank you. You're wonderful. We'll be right back for our next guest.
You don't have to knock yourself out to prevent diabetes. Get real. If you're over 45 and overweight, you can prevent diabetes. Lose 5 to 7% of your body weight, get 30 minutes of physical activity 5 days a week, and eat healthy. Take the first step. Talk to your healthcare provider. Prevent diabetes.
It's not uncommon for a professional golfer to hole a bunker shot for a miraculous birdie. For the rest of us, the bogey save is no less dramatic. Log on to playgolfamerica.com to discover new and easy ways to get more golf into your life.
Play golf, America.
Dr. Lisa Loury Lomas, it's a pleasure to welcome you here to the show.
Thank you for having me.
Well, tell us about your practice.
I'm in private practice. I have offices spanning from Chicago, Midwest, Maryland, District of Columbia. I see individuals, couples, adults, children. I also develop and facilitate workshops and seminars for small corporations and large corporations.
Wow. So in terms of mental health, I mean, that's what we're really focusing on in this segment.
Yes.
What are some of the things that you're telling your patients and telling me, for instance, how should I stay healthy, mentally well?
I think
That's
it's
key.
critically important for people to know themselves and to feel the need to please and empower themselves. Often we get into trouble in our attempts to please other people. We're afraid to say no. I'm always talking to my clients about setting boundaries. Boundaries for other people, but more importantly, boundaries for yourself. Because in our attempts to do everything and be everything for everybody, we all have an S on our chest and attempting to be super people, in particular women, super women and super men trying to do everything. We have to learn to say no, because when you say yes to something, you're automatically saying no to something else, even when you don't realize it.
So where you're automatically trying to help someone else, but yeah, you're right. And when I start thinking about that, you're quite right.
Yes.
How do you say no? I mean, how do you let people know that you're choosing,
Well, I'm big on communication.
Okay.
And if your plate is full, I would say my plate's full, but keep me on your list, put me on your short list. If I could do something for you next time, please give me a call. And if I'm able, I will absolutely, definitely do it. One of the things I think that is missed by people is when you pile things on top of each other, eventually you are at a level 8. And we're operating, many of us are operating normally on a scale from 1 to 10 at a level 8. And so it takes the least little thing to knock you over, to make you at a 10. And so when you've had a bad day at work and you come home and you see that your crock pot has exploded and you are ready to just end it all, for example.
Yes.
It's not the crock pot itself. Right. It's a minor thing. It's the fact that you are already on a level 8. And so I think people need to be aware of their stress level, of what they can and cannot tolerate, not comparing themselves to other people, not even giving a second thought as to how this appears to someone else. I know that's easier said than done, especially in this society, in this day and age where we're trying to do everything. However, the alternative is to allow the one little minor incident in the house, the dog has an accident in the house, to then take you to level 10. And now we're talking about something very serious.
Level 10, exactly. When do you know that you're kind of, let's say, over the top and a professional needs to now, I need to see Dr. Lisa?
I tell clients all the time that I believe in therapy, whether it's seeing me or seeing someone else. I think that having a mental health professional in your life on a regular basis is important. I have clients that I've worked with for over 15 years who come in for a checkup every now and then. They might not see me monthly, they might not see me weekly, but they might come in once a year, quarterly, every couple of years to check in. Having a relationship with a mental health professional, quite different than talking to your girlfriend, your parent, your spouse, the fellas, because it's a person who cares about you, who has an objective distance, and who is trained to listen for signs that you're getting into trouble. So to answer your question, how do you know?
Exactly.
How do you know? When little things start to bother you, when you're tired, when you as an individual change, whether it's now you're eating more or perhaps you're eating less, you're sleeping more or perhaps you can't sleep at all, you have insomnia, you're easily irritated or annoyed. Often people mistake, I've had clients tell me, I don't have depression because I can get out of the bed. I'm not crying all day. There are other signs for depression. You know, you can be a functioning person who's depressed. And so being aware of yourself and knowing and noticing differences in your personality, in your energy level, and in your behavior.
Wow. So you're noticing these different, signs. And I really, really appreciate what you're saying. We're looking for that. What about our loved one? We're living with an individual and we're starting to see a bit of a change in their behavior.
Yeah. I think it's uncomfortable. The topic of mental health is uncomfortable for people.
Yes.
I'd also like to make sure that I tell people mental health encompasses everything. We're talking stress all the way up to very severe mental illnesses such as schizophrenia, schizoaffective, those sorts of things. So having a mental health professional does not mean that you're at that end of the spectrum. You could simply need a little assistance in managing your anxiety, stress, depression, that sort of thing. And so family members need to look for, again, the same signs. Is there a change in personality? Does your loved one now not want to go out where he or she used to like to go out and have dinner on the town or perhaps go see a movie, and now he or she doesn't want to? He or she is isolating. They don't want to talk. They're sleeping more, or perhaps they're sleeping less. They snap at you and you don't know why all of a sudden. And it's important to stop and say, hey, what's going on? You seem different. More likely than not, the person will say, I'm fine, if they don't want to discuss it. But it's important that as a loved one, you push a little, just a little. And if this person does not respond well to that, then you bring in some other people. I believe it takes a village. And so you get some other assistance. And ultimately, at the end of the day, if you know that there's something wrong and your loved one will not talk to you and open up, I think you cannot be afraid to call a doctor.
Okay. So that's wonderful for you to say, because I think sometimes you want to help and you keep saying, well, that's just their way.
Right.
But you know in your heart
Absolutely.
that it's not there, something is wrong.
Absolutely. Especially if there's a change. Now, if a person generally likes to be alone, some people like to be alone more than others, okay, then that's just their way. But if this is a person who usually engages, then you want to ask and you want to push. You cannot be afraid to probe a little bit. Don't be afraid of getting into someone else's business. Because that's what people often say as well. Oh, well, it's none of my business, or I'm going to mind my business. Actually, it is your business. In this day and age, people are dealing with a lot. There's a lot of stress, economic times, jobs, family, loved ones, the holidays. I mean, there's always something. And so I want you to care about me. If you see that I'm a little out of sorts, stop me and tell me you want to make a suggestion. Maybe I should talk to somebody. Even find a referral if necessary.
Even find a referral. Wonderful. So I think the tips that you're giving us are very helpful. I love the fact what you said. Stop wearing that S.
Absolutely.
Stop wearing that S. As well as you're also saying, don't be afraid to get into someone's business.
That's right.
That if you see something, say something.
Absolutely.
That's what I'm hearing from you.
And don't be afraid to ask for help. There are 1,000,001 self-help books, and there are 1,000,001 people who think that they know the right answer for you. And okay, that might be a good place to start to get a little understanding of what might be going on with you. However, I cannot say enough. Go see a professional.
Go see a professional. Well, Dr. Lomas, I have to just thank you. You are just inspiring. You've given us a lot of good tools for ourselves and for those that are in our lives. I think that's the key. We have to, as you say, it's about a village.
Absolutely.
What a great way to end this segment.
Thank you so much for having me.
Thank you for being here. Thank you.
Do you know how many kids are risking their health by eating unhealthy foods, stuffing themselves, and not getting any exercise?
Thank goodness. You got here just in time. Where's the problem? In there.
Hey, what's going on? What are you doing?
Here, try this. The original fast food.
Doctors know that our children need a diet rich in fruits, vegetables, high-fiber vegetarian foods to help them grow up healthy. Call for a free booklet or visit kidsgethealthy.org.
Dr. Huynh, thank you so much for being here on the show. It's a pleasure. I really was so interested in hearing about your perspective on medicine and about what's affecting childhood and adolescence. Give us a little overview about, first of all, about yourself, because I was fascinated when I read your resume.
Thank you, Ingrid. Thanks for having me on the show. I am a family practice preventive medicine physician. I've been a physician for over 20 years, I think close to 25 years.
Wow.
And my passion is on health. And I'm also a mother of 3 boys, ages 10, 15, and 20. So in my studies and constant review of the literature, I always look for things that I can apply to my family, not just some things that I could offer to my patients. So several years ago, I came across a study that's done by the Center for Disease Control and Prevention, the CDC, in partnership with Kaiser Permanente out in San Diego. And I'm not an employee of either one, so I'm really citing this from just a physician and more importantly, as a mother. And the study was based on adverse childhood experiences and looking at 17,000 adults in the United States to see what childhood experiences may impact us adults' health behavior or health outcomes. And the study resulted in looking at these 10 questions that we can ask adults about their perspective of their childhood experience, and has a direct correlation to health behaviors. So the questions are like, do you ever felt unloved? Do you ever felt unsafe? Are your parents divorced? Have you ever seen your mother or stepmother hurt? Do you live with anyone at home that has a drinking problem? Or have anyone in the home ever been in prison? And those 10 questions actually have direct link to health issues such as depression, mental health issues, obesity, other chronic conditions. So as a preventive medicine doc, I feel, a lot of things I am treating today are preventable, but maybe we even need to go as far as looking at what we are doing and what kind of environment we are setting in the homes today. So I'm very sensitive to the fact that we want to create an environment, and personally, it's in our home to make sure that all boys have a positive experience as they grow up, that they feel loved. And it's interesting that the studies show that these negative experiences are additive, meaning that, for example, if you grow up in a household where your parents are divorced or separated, and also when your parents have a drinking issue, or you ever felt you don't feel love, those things actually add up. So it is additive, and it has such a long-term effect. Things you experience when you're 8-year-old now impact you when you're 50 and 60. So that gives us as parents, I know, it gives parents such an incredible responsibility when you feel that environment that you set in your home today can have impact on your child's health when they're in their 30, 40, 50s and older.
And older. My goodness. So it's almost, and my philosophy has always been when it comes to the children, they're like precious jewels. And, how do you treat a precious jewel? You're really very careful. Right. And that's what they are.
Yes.
How do we stop, there's so many negative things, and what are some of the changes that we ourselves can do? Does some of your research show that?
Yeah, I think first is as parents that we want to think about child rearing as truly a responsibility, truly being responsible for our children, knowing that environment and experience that we set for them today have a lifelong impact. I think as parents, I hope parents are listening to this today and recognize that, gosh, things they do have huge impact. So positive experience bring about positive health for their children, whereas negative experiences do have lifelong impact. So first is that we recognize that being a parent comes with great responsibility. And then second is recognizing that we need to be mindful of the experience that we are giving to our children, that we do have incredible responsibility and ownership in providing a healthy, happy experience for our children.
Wow. So, and to be mindful.
Yes.
So I would even just say even in the environment about what we're watching on television and those everyday kind of activities.
That's right. It is really a complete package. Your prior speaker talked about healthy eating, so that's one aspect. And then, the mental health aspect. But truly the experience is we're all human beings, mind, body connected, right? And you get a certain experience, whether being with someone, the food is important, but also the safety that you feel in the home is so critical.
So for our viewers who are out there watching this, what's something that you want them to remember?
Yeah. Create a positive experience for your family. Take one day at a time. I know we all live in a very stressful world, especially here in the DC area where commute is so, it's such a hectic, most parents are, working, both parents are working, so when you come home, before we walk in the door, one thing I usually do is just stop, take a deep breath, and then let all the stress at work stay at work, and you walk into the home, and you create a healthy, happy experience for yourself as well as for your kids.
Wow.
So a pause before you walk in the door.
Well, Dr. Huynh, what words of wisdom have you provided? I know your patients are very fortunate to have you as their physician. Thank you so much for being on the show.
Thank you, Ingrid.
I'd like to thank our wonderful guests for giving us the ways that we can have a healthier life. Each of you are phenomenal. In closing, I have the words from Robert Urich. A healthy outside starts from the inside. And I do believe that with great information, we can have and make healthier choices and be successful at it. It is success that I wish each of you. So for show information, please see ingridsworld.org, and I thank you for watching.